Elizabeth Tanzi, and we're here today to talk about the Ultherapy procedure. Ultherapy is HIFU, which stands for High Intensity Focused Ultrasound. So basically we're taking the ultrasound waves and delivering them through the skin to heat up the lowest layers of the skin. Ultherapy does it through 3 separate handpieces, transducers, that are chosen depending on the level of the skin that we want to treat. Ultherapy is best for mild to moderate skin laxity, more severe skin laxity. Those patients will probably be disappointed with treatments. Typically, when I'm talking to patients about the treatment, I set realistic expectations that this is a skin tightening procedure that will take time because the collagen stimulation process takes time to develop. So we talk about doing a treatment and then waiting a full 6 months for the final result. And oftentimes I'll recommend a second treatment to get even better improvement. So we have our patient here who's concerned with some lower face and jawline laxity. So she's got mild to moderate laxity. We're going to be concentrating in the areas through here. When I'm treating the lower part of the face with Ultherapy, I do provide pain management. Typically, I will use Demerol 50 to 75 milligrams IM and Valium 5 to 10 milligrams PO, and patients clearly need to get transportation home. Okay, so here we are with our patient. She's been appropriately medicated, she's feeling relaxed, and she's also been marked out for treatment. These are the markings as outlined by Ultherapy. It's important to avoid the areas of the potential marginal mandibular nerve in through here, so these are the areas that we don't treat. And we usually go ahead and mark those with an X, as well as potential for temporary nerve injury on the forehead as well. And all the way up, we also mark out the area over the thyroid not to treat. Ultherapy procedure is performed by registered nurses. You'll see Lemieux here putting on some gel to ensure good contact with the transducer. It's ultrasound gel. And we're going to start with transducers that go the deepest. So at this point, we're going to start with a 4.5 transducer, so 4.5 millimeters into the skin. And then we'll progressively change to transducers that are, deliver more superficial heat. On the screen here, you can see, in just a second, we'll see an image of the skin. And we'll ensure that we're in the proper, so here we are on the surface of the skin, down through the dermis. Here is a level of, we have a level of muscle, and then the fat under the muscle. So here we are at 4.5 millimeters in the skin. And this is appropriate for her. The see and treat technology is important because you can see where you need to treat, so you can get to the deepest level you want, but you don't want to go so deep depending on the area that you're going into bone, because it makes not only the procedure much more uncomfortable, but also you're not getting the heat in the area you want to help stimulate neocollagenesis to get the ultimate result. So this technology is very powerful for the ability to see and treat. So here we are with the 3 millimeter transducer. Now we've already delivered a certain number of lines with the 4.5 millimeter transducer. Lemieux is going and looking into the skin to make sure that we're not delivering energy into the bone or too deep. This is perfect. We can go ahead and get started. So as you can see, this is a procedure that takes time. It will take, depending on where we're treating, anywhere between 45 minutes to an hour and 15 minutes, depending on the number of lines that we're going to place in the lower part of the face. In the lower part of the face, we usually will place anywhere between 700 and 900 lines for the lower part of the face and neck. If we're doing the full face, which includes the periocular area for lift, we could get up to 1,000 to 1,200 lines, depending on the patient. Patients can expect to feel a little sore, particularly along the jawline and the submental area after the procedure. There may be some little red, what looks like cat scratches related to the procedure that resolve typically within hours to a few days. They can cover those with makeup. Bruising is possible. It's relatively rare, but it is possible, particularly when it's seen around the periocular area. It can look like a black eye, so you need to warn patients about that, but it is unusual, as well as the very rare side effect of temporary nerve injury. Sometimes there have been several reported cases of marginal mandibular nerve injury where patients had an asymmetric smile for 2 to 3 months. Patients can rest assured that that is a temporary phenomenon, but certainly it is something that we try to avoid, which is why we specifically mark out the area prior to treatment.